we see really four main hallmarks or categories of the manifestations of myelofibrosis for our patients. One are the symptoms related to cytokines, and then what we would call constitutional symptoms. So, this is when people have fevers and night sweats, fatigue, bone pain. Some of them end up presenting with thrombosis, unfortunately. We see a lot of pruritus or itching, weight loss. Sometimes that's due to cytokines, sometimes it's due to splenomegaly or both. Some of these patients have significant dyspnea as well, which may be anemia related, but sometimes potentially other causes like splenomegaly. We certainly see abnormal hematopoiesis, so we typically see anemia, thrombocytopenia, whereas we might see elevated platelets in PV or ET, and usually see low platelets in MF or normal platelets to begin with, and then typically leukocytosis. And then we will see splenomegaly and sometimes hepatomegaly. The splenomegaly can cause significant weight loss, abdominal pain or bloating, shortness of breath, and particularly early satiety, which is part of what can cause the weight loss. And this often leads to muscle mass loss and physical dysfunction, where patients will lose mobility. And then, in conjunction with the cytokine and constitutional symptoms or issues, they often don't feel like doing a lot and they really can waste away. But upwards of almost a third of patients have no symptoms at diagnosis. And it's great for those patients who don't have those. Sometimes that means they don't always need treatment right away, but it really depends. But generally, over time, patients will have progressive symptoms.